This is being recorded, so thank you. I'm Della Leister, the Deputy Health Officer for Baltimore County Department of Health. Thank you for joining us this evening on our continuing community webinar series. This is one in our series. We've had about 6. They can be found on our social media page and back on our YouTube page if you ever want to see any of them. This one is also being recorded, so if you've attended or you want to review it later or share the link with friends, they will be able to view it at a further time. The topic we're talking about tonight is isolation and loneliness. This can be a challenging individuals. If you do feel uncomfortable at any point, we encourage you to use some of the resources that you're going to hear about tonight, or to disconnect and call the 988 number, which will get you the resources you need. We do ask that you hold questions to the end. We will have an opportunity then. You can put them in the chat, or we will let you unmute yourself to ask the question verbally. We ask that you not give us any personal health information either in the chat or verbally. So now it is my great pleasure to introduce our presenter for tonight, Amy Francis, who is one of our public health nurse administrators in the department, overseeing a program seniors, and so has a lot of experience on combating social isolation and loneliness. So Amy, I'll turn it over to you.
Thank you, Della. Good evening, everyone. So when was the last time you truly felt connected to someone? A 2022 study found that when people were asked how close they felt to others emotionally, only 39% of adults in the United States said they felt very connected to others. Did you know that loneliness and social isolation are not just emotional experiences? They are public health issues that affect all age groups. 1 in 2 adults in America reported experiencing loneliness, with some of the highest rates in younger adults. In 2023, the CDC and the Surgeon General declared loneliness an epidemic linked to higher risks of heart disease, stroke, dementia, and premature death. This provided us an opportunity to take action and invest in having more socially connected lives. Tonight, we will talk about not only the risks to our health, but the opportunities to strengthen and build our connections, improving our health and hopefully our happiness. So tonight we will define the differences between social isolation and loneliness. We will trend social isolation in our American culture. Then you will reflect on your relationships and barriers to connection using a poll. Please have your phones ready so that you can scan the QR code at that time. Then we will understand the affected groups and their unique risks. We will discuss these risks and the health impacts of social isolation and loneliness. Then we'll move on to identify local resources. We'll talk about some action steps for individuals, and we'll close with a call to action. So it is crucial to distinguish between social isolation and loneliness because while they are related, they are distinct concepts. For example, social isolation is defined as the lack of social contacts and having few people to interact with regularly, while loneliness is the distressing feeling of being alone or separated from others. However, it's important to note that it is possible to feel lonely while being among other people, and you can be alone and not feel lonely. Recognizing the differences between these two allows for tailored interventions. For example, addressing social isolation might focus on building your social networks, while tackling loneliness could involve strategies to enhance the quality of your existing relationships. Having established the distinction between social isolation and loneliness, we now aim to reflect on the origins and progression of the loneliness epidemic. Recent studies indicate a growing trend of social isolation within American society, highlighted by data showing that more time spent in solitude, reduced social interactions with friends and family outside of our homes, and a notable increase in reported feelings of loneliness. In the early 1900s, church membership surged, as did labor union participation, book clubs, volunteer groups, and associations of all sorts thrived. Also in the 1930s, video entertainment existed only in theaters, and the typical American went several times per month. In the mid 20th century, the 1950s to the 1960s, we saw a rise in new technologies, particularly the automobile. And this led to a shift in values toward an unbridled individualism. Cars facilitated greater geographic separation, promoting the growth of our suburbs and a more private lifestyle. As a result, social gatherings became less and less frequent, with people only entertaining guests about once a month. And the rate of hosting has continued to decrease by 45% from the 1950s to the 1990s, followed by an additional decline of 20% in the years since. In the 1970s, the United States entered a notable era of withdrawal, famously captured in Robert Putnam's book, Bowling Alone. This period saw the introduction of television, which contributed to further social decline. For instance, the percentage of seventh graders with a television in their bedroom rose from 7 to 77% between the years of 1970 and 1999. Additionally, during this era, the government reduced investment in the construction of public spaces. In the late 20th century, the 1980s to the 1990s, we saw a further rise in single person households, with increased divorce rates and delayed marriages contributing to a potential increase in social isolation. Additionally, from 1985 to 1995, active involvement in community organizations fell by half. In the early 21st century, self imposed solitude emerged as a significant social factor. With the rise of social media, people are increasingly opting for more remote experiences, taking meetings from home, shopping online, dining solo, enjoying entertainment at home, and even participating in church services virtually. In fact, adults spent an average of 99 more minutes at home each day compared to previous years. And in today's society, there is a growing concern about a loneliness epidemic, with research indicating that increased screen time, reduced in person interactions, and a rising number of individuals living alone, especially among older adults, and which may contribute to this issue. For instance, data from the online reservation platform OpenTable reveals a 29% increase in solo dining over the past 2 years. Additionally, the average teenager spends approximately 270 minutes on screens during weekdays and 380 minutes on weekends, accounting for nearly 30% of their waking hours. Meanwhile, the typical American adult only purchases 3 movie tickets per year and devotes around 19 hours per week to watching television at home. Now let's take a moment to reflect on your relationships and barriers to social connection. I'll give everyone a moment or two to scan the QR code while I pull up the poll. Our polling questions tonight, they are anonymous, and they are: how often do you interact with socially with individuals outside of your household? Oh, great. Thank you. Results are coming in. And what is the biggest barrier to increasing your social interactions? Give another few moments. All right. So, how often do you interact socially with others outside of your household? 57.1% indicated that they interact with others outside of their household daily. 28.6% indicate that they interact with individuals outside their household a few times per week. 7.1% indicate that they interact with others outside of their home once per week. And 7.1% indicate that they interact with individuals outside of their home a few times a month. And we have 0 responses in the rarely or never category tonight. And then, what is the biggest barrier to increasing your own social connections? We see that we have 50% in the lack of time category. It is very hard to make time to interact with others. And 28.6% is a preference for solitude. 21.4% is other. And some of those responses include finances, awkwardness, busy schedules, and having difficulty getting others to commit to time. And that's increasingly difficult around the holiday season. So, thank you all for participating in the poll and reflecting on your own relationships. I think it helps as we move forward through this information to think about it from our perspective as well. So, now we're going to talk about who's affected. Social connection is dynamic, changing over time, and can be improved or compromised for many different reasons. Include transient feelings of loneliness may be catalysts for reconnecting socially. However, chronic loneliness can be linked to more significant health concerns. Raising awareness can help individuals consider ways to foster connections outside of traditional pathways. For our youth, teens are navigating identity and belonging, making social exclusion even more painful and difficult. Seeing idealized holiday posts on social media can heighten these feelings of inadequacy or being excluded. And end of semester stress may compound emotional fatigue and disconnection. And for our working adults, remote or hybrid work environments reduce daily interactions, and balancing work and family needs can lead to burnout. And having strained family relationships can increase your feelings of disconnection, especially during the holidays. And loneliness is also linked to lower motivation, decreased focus, and lower job satisfaction. And while parenting can be deeply rewarding, it comes with stressors. Juggling work, caregiving, and holiday planning can lead to exhaustion and emotional withdrawal. Parents often prioritize their children's needs, leaving little time for their own peer relationships. And older adults face distinct challenges that make social isolation even more likely. Nearly 27% of adults age 65 and older, 1 in 4, live alone. Holidays may trigger grief from the loss of a spouse, siblings, or close friends. Physical limitations can prevent participation in social events, and limited technology access and literacy can sometimes hinder virtual connection opportunities. Those experiencing sensory or cognitive challenges may also struggle to engage in typical holiday interactions and events. And our individuals with disabilities may have accessibility barriers like limited transportation, inaccessible venues, or lack of adaptive equipment. And reliance on caregivers can restrict their autonomy and spontaneity in making their own social plans. 61% of disabled individuals report chronic loneliness, with even higher rates among younger adults. And thinking about intersectional factors, poverty limits access potentially to technology, transportation, safe gathering spaces, and creates financial stress that can prevent participation in holiday events or gift exchanges and may correlate with housing instability, which further disrupts social networks. And marginalized groups like our LGBTQ plus community may feel or be excluded from mainstream holiday traditions. And in our communities, these three pillars of resilience, safety, and prosperity are built through inclusive engagement, proactive planning, and equitable access to resources, especially during the holidays when social isolation and economic stressors peak. Access to social opportunities are not the same for everyone and often have compound impacts. As Audre Lorde said, there is no such thing as a single issue struggle because we do not lead single issue lives. So, what are the risks of social isolation and loneliness? Social relationships are a vital component of our human life. With most of adults cultivating meaningful connections with family, friends, and neighbors. When these relationships are challenged, the resulting distress can affect various aspects of life. Consequently, a deterioration in social connections can negatively impact psychological well being, affecting mood, behavior, and overall health. For example, a systematic review conducted by Valtorta revealed that poor social relationships, social isolation, and loneliness can significantly increase the risk of heart disease by 29% and stroke by 32%. Additionally, research highlights the detrimental effects of social isolation, including loneliness, social withdrawal, living alone, and insufficient social support on mental health. A notable study by Van Orden et al. Identified social isolation as the strongest and most compelling predictor of suicidal ideation, attempts, and lethal behaviors across diverse age groups, nationalities, and clinical severity. Substantial evidence also links social isolation and loneliness with accelerated cognitive decline and an increase of risk of dementia in older adults, including Alzheimer's disease. In fact, chronic loneliness and social isolation can increase the risk of developing dementia by approximately 50% in older adults after controlling for demographics and health status. And finally, a meta analytic review by Holt Lundstadt showed that social isolation, loneliness, and living alone are all independently associated with a more than 25% increase in the likelihood of mortality. These findings underscore the critical need to address social isolation and loneliness to promote better health and well being. Why is it important to increase social relationships? Fostering social connections is essential for our overall well being. These connections not only improve our mental and physical health, but they also play a vital role in preventing various chronic diseases, elevating mood, boosting immune system, and contributing to increased longevity. Research indicates that individuals who feel a strong sense of community belonging are 2.6 times more likely to report good or excellent health as compared with those with a weaker sense of belonging. Also, researchers estimate that having strong and secure relationships not only increases our happiness, but also our longevity by over 50%. Additionally, according to the Surgeon General, being socially connected may reduce the risk of developing hypertension by up to 59%. This evidence highlights the importance of encouraging individuals to cultivate and strengthen their social connections, ultimately leading to a positive impact on their health and overall quality of life. 988 is more than a suicide prevention hotline. It's a lifeline for anyone struggling with loneliness, social isolation, or emotional distress, offering immediate human connection and support when it's needed the most. 988 is a free and confidential 24/7 service in the United States that connects people to trained crisis counselors. It's not only for those in immediate danger of suicide, it also supports individuals who feel socially isolated, lonely, or disconnected, offering someone to listen and provide judgment free care. Talking with someone can reduce feelings of isolation and remind callers that they are not alone. Additionally, our Bureau of Behavioral Health connects residents to therapy, medication assistance, and crisis support through nonprofit providers. Call 410-887-3828 to learn more. And the NAMI helpline is a free and confidential nationwide service that provides one on one emotional support, mental health information, and resources needed to tackle the tough challenges that you, your family, or friends are facing. And they are available from 10 a.m. to 10 p.m. each day. And finally, the Commission on Disabilities offers resources to individuals with disabilities and supports them to participate in all aspects of community life. You can call 410-887-2483 to learn more. And for our older adults, the Baltimore County Department of Aging offers senior centers with free in person classes, and they also offer online programs or adult learning known as OPAL. They can be reached at the Maryland Access Point to hear more information about services available and how to visit a senior center at 410-887-2594. And finally, MTA Mobility offers resources for transportation for individuals that have disabilities, and they can be reached at 410-764-8181. For our older adults, the Mental Health Association of Maryland helps older adults cope with isolation and depression. Please call 443-901-1579 to hear more about their peer connection project. There are also geriatric services available. Our Bureau of Mental Health can provide more information about how they work with seniors and their families who need help coping with typical problems that arise with aging, such as depression, anxiety, relationship conflicts, and difficulty coping with loss and other life changes. And finally, AARP Friendly Voice offers trained volunteers who provide a call to chat, to listen, or just to say hello. You can call 888-281-0145 to connect. So, what can individuals do? We all understand that having stronger connections, social connections, contribute to longer, healthier lives, and social disconnection is linked to poorer health outcomes. So, how can we foster deeper connections in our daily lives? We can invest in and nurture our existing relationships, reaching out to someone you love or care about each day. We can do this by being fully present. Put away your cell phone, give your full attention, and genuinely listen. Learn more about the people who matter most to you. Seek opportunities to help. It not only builds connection, it brings great joy. Practice being responsive, supportive, and grateful. These three habits increase the likelihood that others will reciprocate, strengthening your relationship bonds. Think about what might happen if you reached out to someone in your life and told them how they've made a difference in yours. You might be surprised at what comes back to you. Practice gratitude daily. Gratitude helps us shift to a more positive mindset, making social connections easier and even more natural. Engage beyond your circle. Connect with someone who is different from you. Participate in social and community groups. Ask yourself, what groups could I join? What are my interests? Do I like sports, fitness, hobbies, crafts? Are there hobbies I set aside that I would like to revisit at this point in life? Do I have religious or professional affiliations that I could reconnect with? Could I participate in community services? We can also reduce disconnection habits. We can spend more time in front of people and less time in front of screens. Think about heading into the office and engaging with colleagues rather than teleworking whenever possible. Seek help when you are struggling. Reach out to your friends, your family, your healthcare provider, or call 988. Let your healthcare provider be your partner in protecting your health. Many providers now offer social prescriptions to increase social connections, in addition to referrals to cognitive behavioral therapy. Make time for civic engagement. Have you ever considered attending a county budget meeting, participating on a board, or a political campaign? The possibilities for civic connection are endless. And finally, be the first to show up. Reflect the values of social connection. Be the first to say hello. Be of service. Show up better for your friends, family, and colleagues. The holiday season is the perfect time to reflect on our connections and to reach out to those who need it the most. Many people feel even more isolated during the holidays as a result of loss, disrupted routines, stress, and unrealistic expectations. Consider hosting an inclusive gathering. Check in on those who are living alone or are grieving this season. Or consider volunteering with organizations that are serving people in need. And finally, our call to action. We invite you all to participate in our 12 Days of Social Connection Challenge. For 12 days, we encourage you to engage in one meaningful social interaction per day to strengthen your relationships and expand your network. This could start with saying yes more, or making a phone call instead of sending a text, or setting up a coffee date with friends or others. And in closing, I want to thank you for joining us tonight and for being willing to participate in the polls and reflect on your own experiences with social connection. And I'd like to leave you with this quote: "Loneliness and the feeling of being unwanted is the most terrible poverty," by Mother Teresa.
Thank you very much, Amy. Looking at the chat, I don't see any questions yet. You are free to put your question in the chat or to unmute. I did put the number for the Department of Aging in the chat, the main number for those of you that are dealing with seniors or have family members that you feel could benefit from services. I find that Department of Aging now has a remote senior center option called Opal, which is although we want people out connected, if you can't get out, it still lets you get connected. So I think that's a great resource. Any questions from anybody that wants to unmute or put them in the chat? Feel free. This was recorded and will be frequently in our social media connections and on through our YouTube connection. I'll look one more time. All right, hearing no questions, I think Amy answered all your questions. Please remember, we also have Ari, our Bureau Director for Behavioral Health. We'd like to promote the 988 number. There are tons of materials that you can obtain because that is a number you can call to be directed for many different services related to behavioral health. All right, hearing no other comments or concerns, great presentation. Thank you, Amy. Great information as always. Everybody have a good night. Stay. Thank you.
Thank you.